Good morning, I'm Navid Jallali. I am a plastic and reconstructive surgeon, and this morning I was going to talk about a abdominoplasty, also known as a tummy tuck. There are two forms of tummy tucks. One is known as a mini abdominoplasty versus the full abdominoplasty, and the difference really depends on whether we move the belly button or umbilicus. I will talk about the full abdominoplasty in a bit more detail. This is probably the second commonest procedure that we carry out in the cosmetic sector, and it's good for getting rid of excess skin and fat, mainly over the lower tummy. Most of the patients that I see are post-pregnancy, and they find that even after going to the gym and trying to lose weight, the excess skin does not go away. The procedure itself is fairly well tolerated. It takes around 2 to 2.5 hours under general anaesthetic, and sometimes we combine it with liposuction to remove the fat around the flanks. Patients would be expected to stay in usually for 2 nights, and sometimes they can go home after 1 night. They will have a tube or drain coming out of the tummy, and that is to take the excess fluid away, and those tubes or drains normally stay in somewhere between 48 to 72 hours. We see the patients back here after a week to have a look at the wounds and expect most of the wounds to be healed within that period. Patients sometimes feel discomfort for up to 2 weeks after the surgery, after which they usually can return to work. We normally recommend that you wear a garment after the surgery, as a special pressure garment, for up to 6 weeks after the surgery, and after that the garment can be discarded.